We have Desert Medical Care and Wellness here to talk about PN and what exactly that is. Also a book and a patient. We're very busy. How you doing?
No complaints.
Nice to see you guys. Robbie, how you doing, buddy?
Good.
Welcome. I'm well. So PN, what is that?
So PN is peripheral neuropathy, and it plagues millions of people in the world. What it is it's the degeneration of your nerves in your legs or your arms, but mostly in your legs. Typically, you'll see it with diabetics. You'll see it with too much alcohol is pretty notorious for making your legs kind of go numb. And there's also idiopathic, which means we don't know why it happened. And it's maddening. When you can't feel your legs, you can't walk normally, you look like you're a robot walking, and it's miserable. It can be painful, you'll have pain, numbness, and tingling, and it ruins your life. So historically, we really haven't had any good ways to treat peripheral neuropathy. People would even commit suicide from the pain.
Jeez.
And it's absolutely horrible. So there were medications that were out there that would kind of deaden the pain or make you care less. But we actually use a different treatment for this, and what we do is we use platelet-rich plasma or alpha-2 macroglobulin, which is A2M, and we actually inject the nerves, and we read some studies on this, but we actually make the nerves wake back up. And we were shocked that it worked as well as it did, but now we're doing a lot of this and actually changing lives. And there is some data on, more data on the platelet-rich plasma, but the new stuff is the alpha-2 macroglobulin, which we call A2M because you don't want to say that too many times.
Not me.
And, but A2M, there are some recent papers out that show this particular protein stops destructive proteins that your own body produces and stops killing the nerves, and that may have a great benefit to idiopathic peripheral neuropathy, which is really cool.
I see. All right. So, Dr. Olesnicki, who's a good candidate for this procedure?
Anyone with peripheral neuropathy, you have pain, numbness, tingling, loss of sensation in your legs. We haven't met the person yet that this hasn't helped at least somewhat.
All right. Wow, changing lives. Dr. Hashimoto, let's talk a bit about this book.
Yeah, well, the book goes over, like, we have a lot of different treatments that we do in the office and a lot of different modalities. So you could get the book for free at freeneuropathybook.com, and it's going to change people's lives. One of the things that we didn't even mention is the balance problems from the lack of sensation. So we've had a number of patients that have gotten in car accidents or fallen over and broken a joint. Robbie's going to share his experience over here with the treatment, so I don't want to take up too much of his time.
Perfect segue. Please do. Share your story, Robbie.
Okay, well, a year ago, I basically had a progression of the neuropathy over the few years before that. But a year ago, I was in so much pain, it was ridiculous. I wore electric socks 24 hours a day, changing batteries every 3 hours. So, because my sensation was my feet were so cold that they were burning. And the feeling was coming up almost to my knee. So I was wearing electric socks all day, all night. It was the only thing I thought about was my feet. If I was watching TV, I was still thinking about my feet. I had a horrible balance problem. I play a lot of golf. I ride a motorcycle. Driving was becoming an issue. And I just had really poor balance. Taking a shower, I had to put my elbow next to the wall, up against the wall, so I could feel it when I was washing my hair so I didn't fall. It was really horrible, and I was distraught. And I tried every cream, every pill that you could get, all these things, gabapentin, all this stuff, and nothing was helping me. I was getting worse. The sensation was going higher up my legs. So
how are you now?
I'd say right now I'm probably at least 50% better overall. In some parts of my, like my leg, I'd say I'm 80–90% better. My ankles are probably 60% better. My feet are probably 50% better. My toes are still maybe in the 40% better deal, but I can wiggle my toes now and feel them wiggling and stuff. So it's way better. My balance is better, and I'm riding my bike again. I'm playing golf every day.
Nice.
Yeah.
You get your life back.
Yeah, I got my
I'm really
life
glad
back.
you were here to share that. My aunt
Thank
suffers
you.
from neuropathy, and I need to share this with her and actually have her come visit you too. That's what we're going to do.
Awesome.
The doctors are giving out a copy of our patient guide to help PN to anyone who watched the online seminar or watches the online seminar. Book a consultation. You can register for their webinar. The number's right there on your screen, as well as the web link. A big thanks to these three for being here, and a big thanks to you. We'll see you in just a moment.